Hello, everyone. My name is Kendall Marshall, and I am a Doctor of Athletic Training student through AT Still University, here to talk about my applied research project, The Influence of Sport Specialization on Quality of Life, Physical Literacy, and Injury History in Adolescent Hockey Players. My faculty advisors include Dr. Nicole Chimera of Brock University and Dr. Tamara McLeod of AT Still University. Sport specialization has been defined in the literature as year-round intensive training in a single sport at the exclusion of other sports. Specialization is typically measured on a 3-point scale, with a score of 0 to 1 indicating a low level of specialization and a score of 3 indicating a high level of specialization. There are numerous proposed risks that specialized athletes faced. A recent systematic review with meta-analysis demonstrated that athletes with high levels of specialization are at an increased risk of sustaining an overuse injury when compared to less specialized athletes. A significant amount of the literature reports on injury risk in specialized athletes, with all finding negative health consequences for specialized players. While most of the research in specialization is geared towards physical injury, another recent review conducted by DeSanti and Erickson reported results related to sport specialization across multiple research disciplines. They found that there are a number of negative physical and psychological effects associated with specializing. Among those included burnout, where the athlete no longer gains enjoyment from their participation, and performance anxiety from internal and external pressures to perform well. Some research has begun to investigate the protective factors of sport sampling, essentially the opposite of specialization, and found improved outcomes on physical performance tests and injury patterns when compared to specialized athletes. These findings point to the decreased exposure to movement patterns that specialized athletes are proposed to face, and the poorer scores on functional assessments indicate an increased risk of sustaining injury and suffering from the negative psychological effects related to their injury. Specific to ice hockey, previous research has shown that highly specialized players tended to be older, non-elite players, with decreasing frequency of specialization seen as players achieve more success. Shepard et al. Found higher levels of hip and groin dysfunction, with lower scores on subsections of a patient outcome measure, including activities of daily living, quality of life, and participation in sport and recreation activities. Investigations into Canadian youth hockey players also found that players who specialized early in their careers demonstrated poorer scores for self-reported physical activity and negative attitudes towards sport and exercise, in addition to negative perception of their physicality. Specializers also receive less social support in their sport, which highlights the myriad of consequences that these athletes face. Injury epidemiology studies in ice hockey players have consistently demonstrated that the most common injuries treated in emergency rooms or physician offices include the head, cervical spine, shoulder, hip, and knee. Previous research in both ice hockey and other sports has found that specialized females are more likely to sustain an injury as a result of their participation. Because many of the investigations of specialization and its effects on ice hockey players have been conducted in collegiate or professional players, the purpose of our study is to identify the specialization rate of current adolescent players while also reporting on their self-perceived quality of life and physical literacy. Our survey was web-based and distributed via a network of athletic trainers and coaches to their respective teams. The email link was sent 3 times at 2-week intervals and required both parental consent and participant assent. Our survey was also distributed via social media, with a recruitment flyer and link available for participants to interact with directly. We obtained ethical approval from the AT Still University IRB and the Brock University REB to conduct our study. Our survey asked participants to answer demographic questions, including their age, gender, and the state or province that they reside in. In addition to the 3-point specialization scale commonly used in research, we also inquired about their participation in hockey and some questions about their most recent injury and other injuries they have sustained while playing. The Pediatric Global Health 7 is a patient-reported outcome measure used in pediatric populations that accurately measures health-related quality of life using 7 questions. PlaySelf is a new instrument with patient and parent reports that can be both used to accurately measure physical literacy in adolescents. Both of these instruments have been validated and found to be reliable in our population. Our survey initially yielded 92 responses. 38 responses were discarded due to the participants not completing the entirety of the survey, while another were discarded as the participants indicated that they did not consider ice hockey to be their primary sport. A final total of 42 participants completed our survey. Here you will see that we had similar numbers of male and female participants, with 23 males, 18 females, and 1 participant who identified as non-binary. We found high levels of specialization, with 42.9% of our participants demonstrating a moderate level of specialization and half of participants reporting high levels of specialization. The average age of our participants was 16.4 years old, with more than half reporting that they sustained an injury in the past 12 months as a result of their ice hockey participation. The number of injuries sustained was not significant when comparing between specialization levels or by gender. You will also see that moderately specialized players began playing competitive ice hockey at an earlier age than low and highly specialized players. A majority of participants reported playing on 2 teams throughout the year. However, our survey did not inquire whether these teams were played on concurrently or at different points throughout the year. As expected, we saw an increasing number of hours spent participating in hockey-related activities with specialization level. However, these differences were not significant between groups. You will notice, however, that both moderately and highly specialized players played in excess of the mean age of the group. Overall, we found high levels of quality of life with no group differences amongst most components of the PGH-7 and total scores on the instrument. On question 6, which asks, how often do you have fun with friends? Participants did demonstrate between group differences, with low specialization athletes scoring significantly lower than moderately specialized athletes and a trend towards being lower than highly specialized athletes. We also found that the mean scores for highly specialized players were lower than their counterparts. These differences were not statistically significant for both literacy in different environments and general physical literacy. All 3 specialization levels rated physical literacy as most important, compared to numerical literacy and reading literacy, which suggests that regardless of specialization level, young athletes perceive their athletic identities and abilities as most important to them. Participants reported a total of 31 acute injuries and 24 chronic injuries, with 38 of those requiring some level of participation loss. Interestingly, we observed more acute injuries than chronic injuries, which was not expected based on previous research findings. Most injuries sustained experienced less than 1 week of lost playing time, with slightly more than 10% of injuries resulting in more than 1 month of participation loss. It should be noted that to assess body regions injured, participants were asked about all injuries sustained within the last 12 months and were instructed to recall only their most recent injury when they were asked about playing time lost. As alluded to previously, our level of moderate and high specialization was much larger when compared to previous research. A little over 90% of our sample was found to be either moderately or highly specialized. Research conducted by Black et al. Found that among professional and collegiate players, 11 to 28% of players chose to specialize, while Shepard et al. Reported a more even distribution of specialization, with roughly a third of participants in each specialization group. Previous research has sought to identify the reasons why players chose to specialize, with goals of obtaining a roster spot on their high school team or making elite teams often cited as reasons. Perhaps players in our sample have these aspirations, in addition to having the financial ability to play on multiple teams. Hockey is known to be an expensive sport to participate in, with some research having suggested that athletes living in suburban areas and those with higher household incomes may be more likely to specialize compared to others. Our study did not evaluate these criteria, but this may be of interest to future researchers given the complexity and variety of reasons why athletes and their families choose to specialize. Current evidence suggests that adolescent athletes should participate in no more hours per week in sport than their age and avoid participating on multiple teams in one season. Most players reported playing on 2 or more teams, with the potential for season overlap very likely given the times when most rinks are operating throughout the year. Despite their increased participation and the number of injuries seen in our sample, our participants reported high levels of quality of life and physical literacy when compared to normative values for both instruments. This suggests that specialized players continue to gain enjoyment from their participation. At this age, teammates are often friends with each other, meaning that specialized players potentially spend more time with friends compared to non-specialized players. These findings are consistent with previous research in specialized players of other sports, which demonstrated athletes reported higher quality of life than non-athletes. Players likely specialize in their sport because they are, or they perceive themselves to be, good at their sport. The high level of self-perceived physical literacy suggests that despite their time spent in ice hockey, players are comfortable participating in activities in a variety of environments. Our findings contrast those of a recent Canadian study, which reported lower levels of off-season physical activity and negative attitudes towards engaging in resistance training in highly specialized hockey players. These negative attitudes may not adequately be captured in our study. However, the trend towards significance for question 7 on the PGH-7, how often do your parents listen to your ideas, may be related to these sentiments if participants were answering this question relative to their hockey participation and not simply because they are teenagers disagreeing with their parents. Lastly, we observed no differences between specialization level and whether injuries were sustained, nor between genders and whether injuries were sustained. Both findings contrast previous research and may perhaps be due to our smaller sample size. Ice hockey is a collision sport on the men's side and a contact sport on the women's side, meaning that acute injuries are common and prevalent in both populations. I think it would be interesting to compare acute versus chronic injuries between genders. Again, this is difficult due to our low number of participants. Future researchers need to conduct their research in the adolescent population. While retrospective studies are helpful and more feasible, many injuries may be prevented if we can fully understand the extent of specialization in high school age players. In my own practice, I find it concerning the number of athletes who report participating on 2 or more teams throughout an already busy season. These athletes report that they feel conflicted between participating with their friends on their high school team while also wanting to participate on travel teams where the competition is higher and they feel challenged athletically. While significant change will take many years, providing key stakeholders such as parents, coaches, and athletes with this information can help them to make an educated choice about the decision to specialize and the risks that they're facing. These are the references that I cited. And lastly, I'd like to take a minute just to thank everyone for their time, especially learning more about my applied research, and especially Drs. McLeod and Chimera for their patience, mentorship, dedication throughout this project, anyone who shared my survey with their athletes, and finally my friends and family for keeping me sane and grounded throughout this journey. Thank you.